Next, Arizona Representative Gabrielle Giffords and her husband are back in the national eye this week, bringing renewed attention to her recovery so far. Ray Suarez has our update.
It's a milestone in Congresswoman Giffords' struggle to recover from being shot in the head last January. Tomorrow at Cape Canaveral, Florida, she'll attend the final launch of the Space Shuttle Endeavour. Her husband, Captain Mark Kelly, is commanding the mission. Kelly says his wife was thrilled when she found out her doctors in Houston would allow her to go.
I think she said awesome, pumped her fist one more time.
Giffords was critically wounded in January by a gunman in Tucson, Arizona. Not long after the shootings, she was moved to a Houston rehabilitation facility. And while her early recovery was described as miraculous, signs of improvement are now coming more slowly.
We saw some very early signs, and so we got so optimistic. We were expecting a very fast recovery, and that's not what we're seeing now.
Her doctors say Giffords' speech is improving, but she still struggles with words, using only short phrases like "love you" and "I miss Tucson." Still, Giffords has made enough progress to travel to Florida for the launch, albeit under guarded conditions, with reporters kept well away. On Wednesday, long-distance images showed a figure, apparently Giffords, walking with help up the steps of a private jet that flew her to Cape Canaveral. There, she will join families of the shuttle's other crew members in a private viewing on Friday. But she has prepared for the occasion by writing a personal note for her husband to read in space, and she's also chosen a wake-up song for the crew, just as she did 4 years ago.
Thanks to Gabrielle for that.
And once the launch is past, Giffords has told aides she has another goal in mind: to walk a mountain someday. We did ask for an interview with doctors at Giffords Rehab Center, but they were unable to join us. So for more, we turned to a neuropsychologist who specializes in treating brain injury, William Garmoe of the National Rehabilitation Hospital. And to get us started, what is a neuropsychologist, and what role do you play on a rehab team?
A neuropsychologist is a doctoral-level clinical psychologist who then goes and pursues additional 2 or more years of fellowship training to specialize in brain disorders and brain conditions. So, for example, on a rehabilitation team, a neuropsychologist will work closely with their physician colleagues and the physical and occupational and speech therapist to get a good assessment of the individual, how their injury has affected their cognitive and behavioral functioning, how it's affecting their psychological well-being, and then will provide assessment and treatment along the way, sometimes as long as 10 or 20 years if that's necessary.
Now, noting that you haven't consulted Representative Giffords or her team, can you assume from the fact that she's being allowed to travel that her recovery is continuing and, in her doctor's view, going well?
Well, I think there's I should preface this by saying I think it's a good thing that we don't know a lot about her recovery. Because while Ms. Giffords is a public figure, of course, she's also a private individual and private citizen who deserves her right to privacy for her medical condition and her recovery. So I think it's a good thing that we don't know a lot about all of the details, that we're not seeing a lot of photographs, because she's entitled to that privacy, and we need to respect that. Having said that, I think it is a good thing. We can infer that it is a positive thing that she's being allowed to travel, because if she wasn't sufficiently stable in terms of her medical condition and her cognitive and psychological abilities, then they probably would not let her take this traveling. She's at a very good rehabilitation hospital, and they're going to be cautious about what they let her do. So it probably is a positive sign.
Can the trip itself, just being allowed to do something normal that she would have been doing absent the shooting, be therapeutic?
Yes, actually, I think a trip like this has the potential to be therapeutic. I haven't read a lot about it, but I know some people have raised some concerns. But it can be therapeutic in a few different ways. One is it's an opportunity for the person to do what we sometimes call starting to normalize life. That you have to start to return to do the things that you would normally do if you'd never been injured. It's never going to be exactly the same as it was, but you need to start to resume those roles. And so it's in part it's therapeutic because it's an opportunity to go out into the world and to see what goes well, what doesn't go well. I'm sorry, I was going to say it also can be therapeutic because it's an opportunity for her to resume a role that was a normal role for her. Since the time she's been injured, she's been taken care of, she's been watched very closely, and this actually could be a way that she has an opportunity to resume her role as a spouse and to do something for her husband. So in that way, it also could be a therapeutic thing for her.
We're still just a couple of months in, but what should the public understand about recovery from a severe brain injury, emotionally, physically, regaining your previous capacities?
That's a real challenging question. We like heroic stories of recovery, and we like to have the belief that somebody's going to overcome 100% recovery, return to everything the way it was before. And when you've had a severe brain injury, that's simply not what happens. There are levels of damage that are permanent. There are changes that will not fully heal. And so what the individual needs to learn is they need to learn how to compensate for abilities that have been lost, how to rebuild new abilities, how to resume old roles, but to do it in a different way than you were before. That's the real sign of a successful, and if you want to call it a heroic recovery, that tens of thousands of people who have brain injuries, much like Ms. Giffords had, is recovering from do every day.
So it sounds like you're saying her life will never be the same, but how long will it be till her family, her team of doctors, understand what's possible given where she is, given what she has to come back from, and what the potential is for her taking up a normal life?
It's a real challenging question. Early on, I think Dr. Yokelson mentioned that there was fairly rapid signs early on, and we often see that. And the further out from one's injury, usually you see the recovery curve, or the trajectory, as we say, slowing down, but it can go on for years. For example, when I came into the field, the thought was the first year is where all the recovery occurs. I now am seeing patients for 10 or 15 years who are still showing improvements of one kind or another. So they will be watching to see, and they'll be assessing on an ongoing basis the continued changes that she makes, and they'll be tailoring the treatment in order to maximize the recovery that they are seeing. And for those things that don't recover, then her team will be working to develop ways that she can try to compensate for those areas, that she can find other ways of trying to do them. And honestly, there may be some things that she's just not able to resume, just as anyone who's had a severe injury such as this.
But quickly, we don't know what those are yet, after 4 months.
Correct. It's too early. It's too early to know that. And again, the fact that she that we don't have all those details respecting her privacy is a good thing. So we really don't know unless you're one of the professionals treating her.
Dr. Garmoe, thanks a lot.
You're welcome.